Hi, and welcome to Advanced Healthcare Education, a one-hour presentation on differential diagnosis and treatment planning for speech-sound disorders. My name is Linda D'Onofrio. I'm a speech pathologist who specializes in structural-based speech disorders and oral myofunctional disorders. Before we go any further, I want to disclose that outside of what I'm being paid for this presentation, I have no other relationships with Advanced Healthcare Education, and I'm not selling any videos or books and not benefiting in any other way from this presentation. Again, my name is Linda D'Onofrio. I operate a private practice in Portland, Oregon, where over the years my specialty has developed into structural-based speech disorders, and I often work with school speech pathologists and speech pathologists that specialize in language disorders to differentially diagnose articulation disorders and things that may be something else. So my first question and how I want to start off the whole presentation is, when is articulation not articulation? A lot of times as children come onto our caseload, we immediately start with sounds, and it's over time that we realize that maybe we're not being successful with them. So what I want the people that are watching this today to begin thinking about is, when is an articulation disorder a symptom of something else? A symptom of either a structural difference, muscle function disorder, or even a placement disorder. I want people to begin thinking about, how long is too long to work on a speech sound? I have kids that have come into my practice that have been working on S and Z for years. So when does a speech sound really need to be looked at in a different way? And finally, what do you do when you don't know what to do? How do you make a referral either to a different kind of speech pathologist or to a different scope of practice? The objectives I want to hit in this one-hour presentation include: I want to introduce the concepts of oral myofunctional disorders and the concepts behind oral placement disorders. I want people to walk away with solid red flags associated with oral myofunctional disorders, which I'll also be referring to as OMD, oral myofunctional disorders, throughout the presentation. I want you to understand the basics behind differential diagnosis for articulation, structural, motor-based and placement disorders, and have a handful of practical treatment techniques that you can use with these clients while they're in your care. There's a dilemma and a controversy surrounding this, and part of it comes from the training we have in graduate school, and also through conversations and arguments that are presented in different magazines. ASHA stance on oral motor techniques, they're also called NSOMs, non-speech oral motor exercises, have been part of the speech pathology culture for more than a decade now. And I really want the audience to understand the difference between blowing and sticking your tongue out and the silly things that you might see in a magazine versus some of the structural stability techniques that I'm going to show you today. I also want to talk a little bit, very briefly, about some of the studies that talk about oral motor techniques as regarding articulation. A lot of the studies that are out there are very small sample size. They don't really look at large amounts of children. The second is, most of the children in these studies are just typical articulation kids, and that children with orthodontic issues, children with dyspraxia, children with dysarthria, children with breathing problems are all excluded from these studies. And these are really the kids that you will see every day and that should be part of these studies, because they're the ones that end up on my caseload. I also want to talk about, there is a difference between things that increase stability and function and range of motion and things that are non-functional and really don't have anything to do with articulation.